May I come in?
Yes.
Hi.
Hi.
My name is Sarah. I'm a student
Hi.
nurse practitioner
Hi.
here. What's your name?
My name is Amy.
Okay, Amy. May I call you Amy?
Yes.
Okay.
Mm-hmm.
So, do you know much about what nurse practitioners do?
A little bit, yeah.
Okay. Well, I do collaborate with Dr. Jones, and
Okay.
I can prescribe and assess and take care of you in a similar way. So
Okay.
we collaborate together.
Okay.
So tell me, what brings you in today?
Well, I just got back from Florida on spring break, and I just am so sore. I have just red skin on where my sandals are, and
ouch.
then on my bikini area, my shoulders, my back. It's just so red, and it hurts so bad.
My. When did this all start?
About 24 hours ago.
Oh, wow. You just got back
Mm-hmm.
from Florida. Wow. So
Yeah.
tell me a little bit more about that. So did you go for spring break?
I did. I went out for spring break. I spent all day on the beach in a bikini for about 10 hours during the daytime. And it's so painful, this redness. I can't stand it. It's just like beet red, and there's blisters starting.
Oh, my.
It hurts so bad.
So, okay, so you told me a little bit about where you have it. You were in the sun all day.
Mm-hmm.
Approximately how many hours do you think you were in the sun?
For about 10 hours.
Oh, wow.
Yeah.
And can you tell me, on a scale of 1 to 10, 10 being the worst pain of your life, sitting here right now, you would rate this pain?
Oh, like an 8 out of a 10.
What about if I were to touch those areas?
Oh, might be a little higher then, but right now it's an 8.
Okay, so does anything make the pain better or worse?
Not really. I mean, if I just sit here and don't touch it, then it's okay. But I really haven't done anything to, make it feel better.
Have you taken any medicine?
Well, I am on medications. I have terrible acne that I've had for the past 5 years, and it's on my chest and my back and my face. And the only thing that really gets rid of it is the doxycycline that my doctor prescribed.
Oh.
So I've been taking that. I also take birth control pills and multivitamin.
Okay, all right. So you haven't tried any aspirin or Tylenol or ibuprofen for the discomfort?
No, I haven't tried anything like that.
Oh, really? Okay. So if has this interfered with any of your daily activities?
It's been uncomfortable to do anything.
Okay.
I did Google sunburn, because that's what I think I have, is just a bad sunburn. So I Googled, how to make it feel better. I did take some aspirin.
Oh, okay.
Yesterday, but it's, it still hurts. It doesn't do anything.
All right, great. A couple things. What type of SPF sunscreen did you use while you were out in the sun?
I used SPF 15 because I still wanted to get some sort of a tan. But I didn't reapply it. I figured one time was good enough.
Oh, okay.
And I forgot, I wore sandals, so I really, I got the major spots with the sunscreen, but I didn't get my sandals.
Okay. Now, did you have a one-piece swimsuit or a two-piece swimsuit?
It was a two-piece bikini.
Oh, okay. All right. Are you having any other symptoms associated with the pain of this?
I do feel nauseous.
Okay.
But I haven't thrown up or anything. It's just, I don't feel good.
Okay. Do you, what about, any, let's see, how would you describe the type of pain?
It's like a burning sensation. I mean, I can't get dressed or move because it hurts so bad.
That's terrible.
Taking a shower hurts with that heat. Heat
makes it worse. Burns are horrible. So I'm gonna just ask you some general questions about your health history and medications and such. How about any allergies to medicine?
I am allergic to penicillin.
Okay, what happens when you take penicillin?
I get a rash.
Okay, would you say this is mild, moderate, or severe?
Moderate rash.
Okay. What about, you mentioned you take doxycycline for your acne. How long have you been taking that?
I've been taking that for 5 years.
Okay. And you're on a birth control pill. Do you take that regularly?
I do.
What's the name of it?
It's called Elise.
Okay. All right. And then what about any other medications that are over the counter or vitamins, supplements, herbs?
I do take a multivitamin, just a generic one, and then I've been taking I took an aspirin yesterday.
Okay. And all right, so moving on to some past medical history. Do you have any chronic illnesses such as diabetes, hypertension, hepatitis, asthma, HIV, or HIV?
No, nothing like that.
What about any history of surgeries?
No.
Any treatments, any ER visits?
No, never been in the hospital.
When was your last exam? When did you last see a doctor?
About a year ago for the acne. I see that one
Okay,
set.
all right. And what about any history of injuries or trauma?
No,
Hospitalizations. Okay. So, what about your family history? Do you have any major medical family history?
No, everybody in my family is pretty much healthy.
Okay. And then, just to get a better picture of, of you as an individual, I'm just going to ask you some general social and personal history. Are you single or dating or?
I'm dating. I've been dating my boyfriend for a while now. He's 26 years old, so he's a little bit older than me, but it works out really good.
Okay.
Yeah, we are sexually active.
Okay.
But I'm on birth control, so.
Okay, and you take that regularly?
I do.
Okay, great. Any condom use?
No.
Okay. So you're a college student. Do you have a job?
I don't work right now. No, just school.
Okay. What about, have you ever smoked cigarettes?
I do not smoke, no.
What about alcohol use?
I do drink alcohol on the weekends at college parties.
Okay. What about any illicit drugs such as marijuana, cocaine, meth, heroin?
No, nothing like that.
Thinking about those, have you gotten, since you're in college, have you gotten up to date on your tetanus and your immunizations, such as tetanus?
Yeah, I needed all of those vaccinations before I started college.
What about your flu shot?
Yeah, I had that too.
Okay, your PPD?
Yes.
Okay. And then, what about your living situation? Do you feel safe at home where you live? Nobody harms or hurts you?
No, pretty safe. Yeah,
Okay,
no problems.
And then when you, some safety concerns, do you wear a helmet when you are on a motorcycle or bicycle or any kind of motorized? Okay. What about a seatbelt?
I do wear a seatbelt all the time.
Okay, good. And do you have any questions for me at this point?
I don't think so, no.
Okay. Well, I'm going to move on to just a review of systems and ask you some questions here, okay? So, any history of fever, chills?
No.
Okay. What about night sweats or weight change?
No, you know what? I do feel feverish and chills sometimes.
Do you?
Just this past last 24 hours.
Oh, yeah, sure.
But not usually.
Okay, what about any nausea, vomiting, or diarrhea?
I feel nauseous, but no vomiting, no diarrhea.
All right. What about any headaches or dizziness?
No, no headaches.
Okay.
No dizziness.
Any chest pain or palpitations?
No.
Any heart problems that you're concerned about? What about any breathing problems?
No.
Okay. Thinking about, your last menstrual period. When was the first day of your last menstrual period?
I had it last week, sometime. I'm not sure on the exact date, but I know it was about a week ago.
Okay, all right. And so, you're on birth control, but no condom use, correct?
Yes.
Okay, so what I'm going to go through now, I guess one more question. What about any changes, any pain in your kidney area, bladder area, changes in your urination, frequency, discharge? Okay, so what I need to do next is I'm just going to take a look examine you and listen to your heart and listen to your lungs. And I'm just taking a look at the vital signs that MA picked up, and those were all good. 126/68 for blood pressure. Your temperature was okay at 97.6. Heart rate 96. So now I'm just going to move along to listen to your heart and lung sounds. Okay. So normally I would do this in skin to skin, okay? But for the purposes of this exam today, we won't.
Okay.
Just pardon me. I want to listen to it with a vowel. Okay, now I'm going to just find your PMI, alright. About fifth inner space, mid-clavicular. Okay, now I'm going to listen to your breath sounds, and then I'm just nice and easy breaths in and out. Alright, now I'm going to listen from the back, and this would also be skin to skin. Alright, good. So now I'm going to just take a look at these burns. Okay. Look at your feet. I'm just going to look here. Oh, yeah, I see. Let me look in your back. Oh, I bet that is painful. I'm sorry. That is something. Well, just a couple things that I thought about to consider, First, I would, thinking about your social history, just something I noticed you don't use condoms, so birth control isn't 100%, so and it doesn't protect you from STDs. So do you know much about sexually transmitted diseases or infections?
Yeah.
Just to be safe, I really recommend that you also use a condom. Okay. Next, I really thought that it's just great that you don't use any drugs or drinking on the weekends. I really would be careful with that and make sure you're with good friends and you don't drink and drive. Number one, okay. So just be safe and be smart.
Okay.
And then next, related to your sunburn, I would consider this second-degree burns. You've got blisters, and so next time you're in the sun, I would really recommend, because you're fair-skinned, white female, you really should wear stronger SPF. So I'd say 60 to 100 now they make. And I would reapply every hour and try to get the waterproof. And then also, I would think it would be smart if you wore a big hat. And just really try to keep those areas covered. Now that you've got, those areas are sensitive, and now they're going to probably scar and be more sensitive. So I would always, and then try to remember your feet. And then lastly, the medicine that you're on for your acne, the doxycycline, it actually has a side effect that makes your skin more sensitive to the sun, called photosensitivity. So I with that being said, if you're on that medicine, you should really be more careful when you're out and your skin is exposed to the sun, okay?
Okay.
So, let me just think here if there's anything I'm missing. Can you think of anything or have any questions?
I don't think so, yeah.
Okay. Well, you could continue with some Tylenol or ibuprofen over the counter for the discomfort, and just maybe do a little more with the promotion health maintenance activities we just talked about. So thank you very much. This concludes our exam.
All right, thanks.